This is a special Family Red Table Talk to get straight factual answers to our questions and yours about the coronavirus pandemic. Just like other families around the world, we are trying to navigate through all the information out there about COVID-19. Speaking of families, you will see that Jaden is not here with us today because he is actually being a responsible young person.
Yes.
He is practicing social distancing.
Absolutely.
He's been doing a lot of traveling, and his main concern has been about GAMI.
Yeah.
So he has decided to stay indoors, and he's actually following orders.
Exactly.
Which is great.
Thank you, Jaden.
He didn't care about us.
He's
He don't care about
watching.
GAMI.
He's watching, yeah.
So first let me say it's critical to listen to the experts and follow the guidelines, or more people will get sick and possibly die if we don't do or follow the guidelines that the experts are giving us. So.
Yeah, and I wanted to do this because in 2008 I made I Am Legend, so I feel responsible for a lot of the
Misinformation.
a lot of the misinformation.
Right.
And just as a family, we've been sitting down and we've been talking. And when I was preparing for I Am Legend, my character was a virologist. So
Right.
I had an opportunity in my preparation for the role to go to the CDC. And there was a basic foundational comprehension of viruses and viral pathogens that I developed, and it really changed my life and how I looked at the world. And there's basic concepts that people do not understand.
I mean, a lot of the language is very confusing.
Right.
Yeah.
Right.
You hear it on the news and you're reading on Twitter and
Right.
you know what I mean? So,
Right.
So what I wanted this to, for us to have that opportunity to just go through the basics and then, bring in the experts.
Okay. To tell us what we need to know is Dr. Michael Osterholm.
Mm-hmm.
I hope I said that
Yeah,
right. That's good.
Dr. Michael Osterholm.
All right, good. He's one of the world's leading experts and on viruses and pandemics.
Absolutely.
And he is a medical detective
Yeah.
who has led many outbreak investigations and advises world leaders on the ever-growing list of health threats.
When I went to the CDC, one of the concepts that I didn't know is the idea of a viral detective.
Right. Yeah.
So in the same way that we have police officers and police detectives that investigate crimes,
Right.
Dr. Osterholm investigates viral outbreaks. And the reason why we have a CDC, even the reason why we have a World Health Organization, is there are people who do this. So for a lot of people, a lot of us at home, this is our first experience with it, but there are professionals and viral detectives and systems in place where people have dedicated their lives to fighting the battle between human beings and viruses.
Right. That's been going on forever.
There has never been a time in human history where human beings were not in a tug-of-war battle with viruses.
Right.
And Willow and I were talking the other night, and we were talking about what is a virus.
and the
That's
difference
a really
between
basic
bacteria, bacterial infection, viral infection, how
Right.
those are different, how they're different, contracting those things.
Absolutely. A virus is essentially a micro parasite, basically. So viruses use our cells to replicate themselves. Like a virus wants your whole body to be the virus. It
Right.
grabs your cells, uses your cells to make more of itself, and that's just what it wants to do. It wants to make as much of itself as it possibly can. It wants to replicate. It uses your cells, and when it uses up a cell, it moves to the next cell. Right? So, and a lot of times it damages or destroys, depending on what the virus is, damages or destroys the cell that it's leaving.
Got it.
Right?
Got it.
So that's what makes viruses difficult for human beings.
Got it. So the doctor is joining us from Minneapolis.
Minneapolis.
And we want to respect and abide by social distance and travel recommendations. So he is
Absolutely.
here with us by satellite. Hey, doctor!
Dr. Osterholm, how are you?
Hi there. How are you?
How are you doing?
We're good.
Thank you for having me.
Yeah, no, thank you very much for doing this.
Right.
This is my wife's show, but talking to you is really exciting for me. So,
Well, I think we could. I think we could actually call you Dr. Smith.
Oh,
With
there
all the
you go.
explanations
Love
you're
that.
giving. I
Love
think you.
that.
So did he
you
give
could do
a
that.
did he give a proper explanation on what a virus is, doctor?
You
Did
know,
hear?
actually, better than most professionals I know. He did a great job.
Thank you. See, I told you. So Willow and I were talking the other night, and I think the first issue was when she hears terms like global pandemic.
Exactly.
So the term global pandemic to Willow means
Contagion.
The movie
movie.
Contagion, or I Am Legend, or The Walking Dead. So when she hears global pandemic, when she hears mortality rates,
Right.
you know, she.
But I have a question for you, doctor.
Yeah.
Because wouldn't the regular flu just be a global pandemic?
Well, actually, it can be. What a pandemic is, in terms of infectious diseases, is when it's a worldwide outbreak of a new virus or a new bacteria that is going to affect people in every continent of the world. So in this case, every once in a while, a new flu virus emerges out of the animal population and causes a flu pandemic. Most notably, many people remember or talking about the 1918 pandemic that was very severe around the world. And now we're actually seeing one almost like that, except it's being caused by a coronavirus.
Right. Absolutely.
So how exactly do you get COVID-19?
Well, we're still learning a lot about how transmission occurs, but then we know a lot too. One of the things that's very notable about this virus is once it jumped into humans from animals, it was humans who transmitted to other humans. And we recognize now that because there's such dynamic transmission, I mean, it's more than 150 countries, it spreads very quickly, that just breathing itself is a very important part of the way it's transmitted. So as I breathe air in and out, obviously I need that. When I breathe out, the virus in some cases will just come out with my breath, and it will hang on very tiny particles that you can't see normally that I'm breathing out. If I get sick and I have a cough, it even becomes more pronounced what I'm breathing, and then you and I share breathing space, and that's how you get infected.
Well, can I ask a question? Because I was on the plane recently. I looked crazy because I had on masks and gloves. So can you explain why masks don't work?
Well, first of all, let's talk about which kind of mask. And I'll even mention the gloves, too, because I think that's an important point. There are different kinds of masks that we have today.
Right.
One is the surgical mask, which actually comes from the term surgery, where in the original days of surgery, a surgeon would, and people working in the surgical area would put this on so that when they talked or breathed, they didn't basically put these particles from their mouth that were coming out as they talked into the incision of the patient. And so it was really never meant to protect the surgeon. It was meant to basically protect the patient. But we've learned that with certain kinds of agents or bacteria or viruses that can be excreted into the air, that in some cases surgical masks will work and will help a lot. In this case, however, because of the very tiny particles that this virus is attached to, surgical masks don't work well. Remember all the spaces on the side of the face you see? That air just goes right through and around. Now, the other kind of mask that people will call a mask is what we call a respirator, an N95 respirator. That's a very tight face-fitting mask. It has basically the ability for air to go through what appears to be paper, but actually it's what we call a matrix. It's a poured material that lets air through, but not viruses. And so in that case, with healthcare workers in particular, we want them to be protected. We want them to wear an N95 mask. So for people just wearing the surgical mask, it doesn't really help you in this disease. You mentioned gloves, and I think it's very important to emphasize, you've heard a lot about hand washing, and as somebody who works with a lot of infectious diseases that are transmitted in terms of foodborne and from people who don't wash their hands well enough after using the bathroom, yes, hand washing is important. But with this disease, we now have enough information to say that it doesn't occur very often from the environment at all, touching a doorknob or whatever, and then putting your hand to your eye. It may occur rarely, but the most important way is just breathing in the air.
Really?
Wow.
Okay, so
okay, now that's a
that's
clarification
different.
right there.
So are you saying that this COVID-19 is airborne, that it exists in the air, or is there a specific amount of time that it actually exists in the air?
Well, some viruses are very capable of surviving long distances. We once had an outbreak here in the Minneapolis-St. Paul area when the Special Olympics came here. And on the opening night ceremony, a young man from Argentina was just coming down with measles, another type of viral infectious disease that can be transmitted via air. And he actually stood on what is home plate in this big stadium, an indoor stadium, and stood there all night. And the next day we realized he had measles, and people who were there as part of the Special Olympics, a number of them came down with measles just from being near him. But we had a few cases that the only exposure they had to the opening night session was being at the Olympics, was that opening night session. And it turned out that they all sat in the upper right field bleachers, way up where nobody could hit a home run. And when we did the studies, we could show that the air came off of the infield behind home plate, and it bounced all the way up into the right field bleachers. And some 480 feet away, this young boy infected those people. Now, that's an extreme case of a virus moving. With this disease, we think it's more kind of a circle around a case, so not just 3 to 6 feet, but in a room like you're in right now, if one of you had this infection, you might be over time transmitted to everyone sitting around the table. So it's not going to go out of the room necessarily or whatever, but it could infect more people than just the person sitting next to you.
Okay, so it wouldn't travel beyond this room, though. So it's not the same kind of virus like the measles.
We're thinking 3 to 6 feet essentially is the current information, correct?
Well, we're actually expanding that now that we know more. Just in the past week, even since you and I have talked previously, Dr. Smith, it has actually expanded a bit. And now that we know that they're in this very tiny particles in the air, so it's not going to be like in the baseball stadium, but surely in a room like this, it could, in fact, occur. And think of that with regard to the different cruise ship outbreaks we had.
Right.
The Diamond Princess, where hundreds of people became infected. We now have good reason to know that the virus moved through the air circulation between rooms in the inner cabins. So that wasn't 3 to 6 feet. That was throughout the cabins of the entire ship. And so it can do that.
So I want to take a second right now, because this is where I can feel Willow feeling the anxiety around the information. So I want to take a minute with this concept. Right. So viral transmission in general can be fluid to fluid. It can be blood to blood. For example, with AIDS, AIDS is transmitted blood to blood, and this pandemic is transmitted airborne, right? So airborne is the most difficult to contain because it's airborne.
That's right.
So Dr. Osterholm, the COVID-19 actually can be transmitted from your hand to your eye, in your nose, less in your mouth, or digging in your ear. You can have COVID-19 on your hand and self-infect. Is that correct?
That is correct, although it probably doesn't happen that often.
Got it.
The more
Got it.
common way is in the air.
Got
But to help you understand that you deal with this every winter when you have influenza in the community.
Yeah.
Think of it just like influenza.
Yeah.
When you go into a public space, you don't sit there and think to yourself, oh my, that person may have influenza. But in fact, we do see it spread around the country. I think, Will, the most important piece of information I can share with you today is that fortunately with this virus, very, very few kids get sick when they get infected. And of those who do get sick, they're often mild illnesses. And so the good news to you is that you don't really have to worry about this as a really big danger to you. On the other hand, to your grandparents or to your friends who are over age 55 or 60. Now you need to start thinking about them. They're the ones that are at greater risk. But you're actually in pretty good shape.
So should young people be the ones that are more aware of like, okay, I need to stay home? Like, because I've heard that you can have it and not even know you have it and not even have any symptoms.
That's exactly right. It may happen, particularly in children, that they don't even know they have it, or it's a very mild kind of illness where you just may feel tired for a day or two.
The difficult conversation is mortality rate. And I think that is a really critical thing that Willow and I were talking about Trey and I were talking about the other night. Dr. Osterholm, can you discuss mortality rate?
Well, first of all, let me just make the point. I think we've really covered some important information here. A disease really is important to us as humans when how it's transmitted and how often you get severely ill. You know, one of the most common diseases that we all get is the common cold. And believe it or not, that's actually transmitted by another type of coronavirus. Now, none of us would suggest for a moment that that's a big, serious public health problem because we don't get that sick. None of us are hospitalized for it. And so that's one that, even though all of us get it, we don't worry about. Other diseases may not happen very often, but when they do, they're really bad in terms of how they actually cause harm to us. The people are in the hospital or they get sick and even die. This disease is kind of in the middle. And what I mean by that is it is easily transmitted. We estimate that as many as 20 to 60% of the United States residents may very well get this over the course of the next 6 to 12 months. Now, the challenge is, who is it going to severely hurt? And as we already just discussed, kids, fortunately, are at the very low end, meaning severe disease is very rare, death is even more rare. The problem is it affects older people who have underlying health problems. In China, where we first saw this emerge, older men who smoked, up to 12% of them died. And that was because not only were they not as capable of fighting the virus off, but the smoking made them more vulnerable. And so one of the things we're looking for is how to protect the most vulnerable people, whose immune systems are not working quite well because they have cancer, who may have some kidney disease problems, who has what we call COPD, or congestive heart disease and lung problems. And so those are the people we want to make sure that they don't get exposed to this virus. And then that's exactly, as you said, Dr. Smith, the idea that, in fact, they won't be dying because they don't ever get it. And so if a whole lot of people get it that aren't going to get seriously ill, that's not good, but it sure isn't bad. It's only when we let the people who are most likely to have serious illness get sick. And that's our job, is to try to prevent that from happening.
Right. Would you also say that part of this, these guidelines that are being put in as well are, you know, to make sure that we don't overwhelm our hospitals and our medical staff across the nation, considering that, would you also say that we're pretty much past containment, that now this is just about hunkering down and just being prepared for the inevitable wave?
Right.
Yeah, I think you've said that very well. Let me just add one context to that. I have said on multiple occasions that as goes the healthcare system, will go how the country feels about this experience. And we learned that in China, where 4,600 healthcare workers became infected with this virus, many of them while working. In this country, we unfortunately are less prepared today to handle a situation like this than we were when I wrote my first article on this back in 2005. And the reason is our healthcare systems have been having taken more and more capability out of the system because it costs money. Today, there aren't extra beds. There aren't extra ventilators around. There's not great capacity. At one time, hospitals used to stockpile certain kinds of these N95 respirators I talked about earlier. They don't anymore. And so now, all of a sudden, we need to protect our healthcare workers so they can take care of us. And when a healthcare worker gets sick and goes from being a care provider to being someone who needs care, that is a big hit on the system.
Yep.
And so one of the things we're trying very hard to do today is make sure that we can give the best health care we can, because that will mean more people will survive and do better with this illness. And it also means that it will have our health care workers there to help us when we need them, and we don't want them getting sick, so we have to protect them.
So I have a question, doctor. If someone feels like they have it, how do you know when it's time to go to the hospital? Because some people are getting sick, but their symptoms are mild. So when do you decide? I think I need to go.
Well, there's actually two parts to that question that we can talk about. First is you want to know if you have the disease or not. You just want to know so you can make sure that you're not out spreading it while going to the public spaces and so forth when you're sick. And so you want to get tested. Now the challenge we have today, and it continues week after week, that we don't have nearly enough tests in this country.
Right.
There's been surely problems in making this test. We test a few thousand people while people in South Korea are testing 100,000 people a week. We're working on that, but a lot of people have been frustrated because they couldn't get tested to see. So today we have a very short list of people with the highest risk, having been to China or knowing someone who is a case already, to get tested. Hopefully that'll change in the days ahead. The second reason you want to know about that is because some people can go on and get severely ill. And it's important to know early in your illness, am I someone that has this virus infection, and I need to be watched carefully so that should after a week I start to get more severely ill, that you might very well be considered to be hospitalized. Not at the moment that you first had it, but later on. Unfortunately, we now know that on average, many of the people who get severely ill and need really high-level intensive care medicine often don't get that sick until the second or third week of their infection. So by knowing that, you and your doctor can work together to figure out, do I need to see you now or not? So it's good to call your doctor if you have a flu-like illness, muscle aches, fever, chills, headache, dry cough. If you have that, then it's worth calling your medical clinic. Don't go in. Don't go to the emergency room. You don't want to expose anybody else if you have it. But then let them tell you what to do and where to be seen.
So what are those all the symptoms, doctor? Like what are the specific symptoms? Is it just the dry cough, headache, fever, body aches? Are there any other symptoms?
Those are the primary symptoms, and if you have a few of them, not even all of them, and you have them for more than a few hours, that's when you want to call and find out, should I come in?
Okay.
Now, fortunately, we're having less and less influenza in this country. We had a bad flu year. And
Okay.
those are also the symptoms of influenza in their early stages. And so we had a lot of confusion. Do I have influenza or do I have a COVID-19 infection?
Right.
And so as the flu season winds down, we are more suspicious when somebody has that kind of a symptom that, in fact, they very well may have COVID-19. And as you've heard over the past days, we're seeing more and more cases in this country who had no known contact with someone who had COVID-19 or someone who had been to a high-risk country for this. And that's what we call community transmission, meaning when we talked earlier about were you in a room with someone, were you in the same shopping center earlier this week before some of them closed, that you didn't even realize that the elevator you rode in may have been the place you got it. And so that's why, again, we want to test, because we also want to know, are we seeing cases in our communities that just have no contact with a known case? That means we have to up our game because we're surely looking at more and more transmission at that point.
So, Dr. Osterholm, can you speak to what
Yeah.
is different about COVID-19 and why are things so extreme in terms of the governmental reaction?
Yeah, compared to just a regular virus.
Right.
And this is really an important point. And I first of all just want to compliment you. I think this discussion we're having around the table today, I've not seen it happen anywhere else at all in the whole world.
Oh, wow.
And one of the things we forget about is how many kids are involved today, not because they're getting sick, because they're not in school and they're wondering why. They're hearing things on the news and thinking, oh my, could that happen to me or my family? And so I think it is important to distinguish here what's going on. 20 to 60% of the population in the United States may become infected. And when you start doing the math on that, 5% may need really intensive care medicine. That's going to overwhelm our system. We're not prepared for that.
Right.
And so one of the reasons why people are so concerned is because we now have to find a way to provide that medical care for those people. That didn't happen with HIV/AIDS because, first of all, it didn't affect a lot of people all at once. It occurred over years and years and years. Right. And they didn't suddenly get sick and need care, but that happened over time. This one is the fact that you today don't have any recognized cases in your community, and next week you have 25. And so I think that that's part of the scariness of this.
Right.
But again, I come back, reassure families that, kids, even young adults, healthy young adults, are going to have very, very little in the way of severe disease with this. And if everybody who got it was just a kid and a young adult, we wouldn't have a problem. We wouldn't be having this discussion. But because of us older people, like myself, who or over age 65, who may have underlying health problems, this is where we have the biggest concern. Doesn't mean we're not going to see some younger people. We've had some doctors in their 30s who have gotten very sick with this, some who have died, but that's very rare. So I think the bottom line message is it's okay to be scared about this, but once you learn the facts, particularly as a child, teenager, young adult, that's good news for you. That's real good news for you.
So this is a critical aspect also. So when people hear terms like flattening the curve, right? So the extreme reaction is based on, now imagine that COVID-19 is respiratory,
Yes.
right? So the issue that people will have is they'll stop being able to breathe. And pneumonia and different respiratory issues. So this virus is respiratory in nature.
Right.
So imagine, I'm just throwing these out. Imagine our local hospital can handle 40 respiratory patients at one time. And under normal circumstances, 40 respiratory patients for that hospital is a lot. They'll be at 12 or 15, so they can handle it.
Right.
The way the virus is moving and the reason why we need to practice social distancing and the idea of flattening the curve is if 50 people show up at that hospital at one time to get 40 beds, right? Now you have 10 people in critical condition that aren't going to get help.
Right.
And your mortality rate shoots through the roof.
Right.
That's the idea of overwhelming the system.
Right.
So there is a certain amount of people that we can handle nationally to come in with critical respiratory issues at one moment. So flattening the curve means not getting to 80 people at one time. We practice social distancing. The virus is going to move through humanity. But as it moves through, we want it to move through at 30 people at a time for our local hospital, not 60 people at a time for our local hospital, because then we have a real problem.
Got it.
So it's no longer about stopping the virus. Right? It's about hospital systems collapsing and the National Guard having to come in and
well, it's about preventing that.
Right? So it's strictly about not having 60 people show up for 40 beds.
Right.
And that's the idea of flattening the curve. So we want over the next 3 to 4 months, because it's not it's going to be a slow pass. Well, we're trying to have a slow pass through the United States, a slow pass that's going to take 2-3 months or even more. Right? Because it's a season. It's not. We're trying to have it be a season and not be an explosion where everybody has it at one time.
Is that about right, Doc?
He nailed it. That's exactly it. That's what we're trying to do. And if we can accomplish what he just said, that will save a lot of lives. Just
Right.
that. Even though the same number of people will get sick, the fact that we can save more lives will be really important. And so that's what we're trying to do.
Do you think that we are slowing down the virus with all the measures that are taking place?
Or is it too early
Or
to
is it
tell?
too early to tell?
Well, I think we are beginning to slow it down in the sense we're getting people to understand it. But you have to realize for most of the country yet, a lot of people don't know anybody who's been infected. And so some people aren't taking it very seriously yet. I keep hearing over and over again, well, influenza's even worse. Well, by the time this gets done, it'll be a lot worse than influenza. So
Right.
sometimes people have to be kind of made aware of what's going on in their community by knowing someone that has it. And I think that's going to happen, unfortunately, far too quickly, and then we'll do even more to try to prevent this. I think the thing that's really important is how do we help those people who are most at risk from actually getting exposed. And this, if there's anything good that comes out of this, is we need to make sure that everybody in our communities who are older, who live alone, somebody watches out for them. You may just run to the grocery store for them and leave the food on the front doorstep so you don't even have to have contact with them. You call them up every day. Loneliness is a really hard thing. And if we're asking people to be alone, then we don't want them to be lonely. And I think one of the things that can come out of this is really a lot of positive connections. We haven't thought about this before. You know, the lady that lives down the street, you know, I should call her up. I should see how she's doing. I should see what errands I can run for her. I should see how I can help. And you know, if we did a lot of that, that'll help this outbreak because it won't put those people, I have to go to the grocery store, I don't have any food, and if I don't go, who will? Well, now somebody will.
Right.
And so I think that this is the better part of what can happen here that can make us a better people, a better country for how we respond.
I totally agree.
So this is the way viruses have passed through humanity. So what happens is people will contract it, and then so let's say let's say someone contracts. Let's say someone contracts COVID-19. After they pass the virus, they become what's known as an immunity rod. Is that the proper terminology, doctor?
Yeah, they become immune.
So they become immune
Yep.
to the virus, and a population becomes immune by passing the virus.
Virus.
I say the other way we're working on is the vaccine.
The
Add
vaccine.
the vaccine in there, because if we can get a vaccine, then we can get them immune both ways.
Do you think that, in your opinion, doctor, do you think there will be a vaccine soon?
I can't say soon. It's not going to save us from the next months ahead. But, you know, within 18 months or so, we may very well have a vaccine. There's a lot of studies going on right now on antivirals, the kind of drugs that could make this a much, much less serious illness. And so that research is going on, too. And we're going to bring all the tools to the table that we have. And if we could get vaccines and drugs, and in the meantime use this social distancing and try to flatten out the curve, that's what's going to get us through it.
Right.
So the idea, because a lot of people are feeling terrified about getting the virus, and if you look at it in terms of, so you know, viruses and bacteria and microbes are the most plentiful entities on Earth.
Right.
Right. So, but most viruses are harmless to even helpful. And then there's a band of viruses that make us sick. And then there's a band of viruses that kill us.
Yeah.
Right? So this COVID-19 is in the band of viruses that make us sick.
Okay.
Right? It's not in the class of Ebola.
Right.
Right? So COVID-19 is a virus that humanity will pass, and we will develop immunity to it. And while scientists on the other side are developing a vaccine, and as Dr. Osterholm said, in 18 months, we'll have a vaccine the same way we had flu vaccines. So it's we're going to try to prevent it, but it's not something that you have to be terrified of contracting. It is something that a huge portion of the population is
Can
going to
withstand,
going to contract.
Right.
We're going to become infected. We're going to become immune and pass it, just as human beings have done forever.
And even with the flu, like the flu changes every
Absolutely.
year. So the vaccine changes every year, you know, because it mutates and it
absolutely.
changes. So the same thing is going to happen with this COVID-19.
For 1 second, can we talk about the difference between an outbreak, an epidemic,
And a pandemic.
pandemic?
Yes. First of all, in our business, we typically use epidemic and outbreak to mean the same thing. It's an unusual group of cases, all somehow common in source, meaning that a measles outbreak, where someone has transmitted it to someone who's transmitted it to someone. They go to a theme park and they transmit it to 20 more. That's an outbreak. We don't expect that to occur. When you have a pandemic, that's a worldwide outbreak, where all these little outbreaks are happening at the same time in virtually every continent in the world. And so we very rarely have pandemics as such. We have lots of epidemics or outbreaks. Like, for example, Will just mentioned Ebola in Africa. We've had a problem with 2 large Ebola outbreaks there that have occurred in the western part of Africa and in the Democratic Republic of the Congo. Other than an isolated case here in the United States that came over on a plane and was hospitalized in Dallas, we've not had that problem here at all.
Right.
And so that's an example of epidemics or outbreaks that never go beyond where they originated from. It's the pandemics that we're more concerned about, because that means it's new. It usually means that many people are at risk, and oftentimes they're spread by this breathing route, which is by far the most dynamic of all the ways for us to spread a virus to others.
So you just used the word dynamic, right? So that's one of the words about COVID-19 that makes it slightly different from a normal flu. And a virus being dynamic, meaning how quickly the virus can replicate within your body, and then also the infection rate. So, doctor, can you talk for a minute about the infection rate of a normal flu versus the infection rate of COVID-19? And the word dynamic as you were using it.
Yeah. Thank you. Yeah, the dynamic part means that just, again, the breathing that, maybe do this. And it also, how many people do you typically infect? When you look at influenza, just seasonal flu that we just have been talking about, on average, people will infect about 1.4 other people, which means that number will grow. It'll go from 1.4 to 2.8. As you can see, it goes up that way. Pandemic influenza, the new strain of virus that just emerged from an animal into humans and now is spread by humans, that one has a rate of about 1.8 contacts, so for every person. And if you add those up, that means it's still growing. It's only when you get below 1, if one person only infects 0.75 people, eventually that dies out. With COVID-19, we think this number may be as high as 2.5 or 2.6 in terms of the number of people each one infects. Well, think about this. If you go, and I'll just use 2 because it's easier math for everyone, but if you go from 1 to 2 to 4 to 8 to 16 to 32, that doesn't add a lot of cases. It's not good. But when you go from 3,000 to 6,000 to 12,000 to 24,000, that's when those numbers get big. And that's what we're trying really hard to do, is stop those numbers from being big, because that's when it's really dynamic. That's when lots of people get sick very quickly. And just as you were saying, Will, not wanting to overwhelm the hospitals, that's when they get overwhelmed, is when we have those big numbers.
Right.
So what you're saying by dynamic is that this is really contagious.
Right. So, yes, absolutely.
That's right.
I just want to talk a little bit about mutation, because I remember when the measles outbreak happened. And
2019,
in
yeah.
2019, and Will was very, very, very concerned about that because it says, you don't understand. It's been dormant. That means that
Yeah.
it might have come back and it's mutated and it's stronger than it was before. So can you explain, can COVID-19 mutate? Can it change in any way right now? Do we have to worry about this strand getting stronger or mutating as is?
Yes. Well, viruses surely can mutate, and we were just talking about the flu just now, and seasonal influenza is one of the most notorious viruses for mutating. That's why we do need new vaccines, sometimes every other year. And that is just because it has a very, very sloppy way that it reproduces itself, and it makes lots of mistakes. And some of those mistakes are to its advantage because now it escapes the immune system of people and it becomes a predominant strain. Fortunately, with these viruses, the coronaviruses, we don't see that. They
Okay.
change a little bit like cosmetically, meaning that enough so that over time we can track them and say, if you saw a picture of me 30 years ago or 20 years ago or 10 years ago, it's still me, but you could tell I'm different. And with this virus, that's all the changes we're seeing. We're not seeing a fundamental change that would make us afraid that a vaccine wouldn't work one day or that somehow it was going to do something worse. There's no evidence that this has done that or that it will do it in the future.
That's
good.
good news.
That's good
I'm really
news,
happy
yeah.
to hear that.
Yeah.
Okay, we're going to just bring in another guest to
absolutely.
join us and the doctor. Her name is Kiara, and she joins us from her home in Los Angeles. She's 25 years old and has been fighting the coronavirus for the last 10 days.
Hi guys, thanks so much for having me. Yes, I'm actually on my 11th day today and happy to report that my fever finally broke after 10 days.
Oh, nice. Okay.
I know. I was quite nervous. My doctor said that on the 11th and 12th I would be admitted to a hospital, so I'm thankful that I don't have to go.
Hi, so you're feeling better. We're glad to hear that.
How did you contract COVID-19?
So I became ill on March 6th, so 11 days ago. And the week before, I had a friend that flew in from London. And after like 2 or 3 days of him being in town, we thought he, at that time, had like a little bit of bug. And it was a domino effect, and 6 of my friends, including myself, ended up getting it.
And what were your symptoms?
We each have had really high fevers, horrible body aches, and weirdly enough, almost everyone in my age group that I've talked to with corona has this crazy symptom of not being able to taste or smell anything.
Wow.
Yeah, and then on my 5th day, I started to get this like shortness of breath and like this kind of tightness in my chest. That's when I got really nervous because, as you guys know, when it goes to your lungs, it's like, that's when it gets scary. So I got my lungs checked. I finally got checked out. And since then it's just been a really high fever and I finally beat it.
So you said there were other people in your group. Are they the same age as you? Are they a little older than you were? That you said that
so
contracted.
everyone's in our 20s. Yep, everyone's in our 20s,
And
between the
all
age
of
of like
you in your
25 to
20s.
28.
Okay.
Yeah.
Did any of you have any other underlying health challenges?
So I'm the only one that's immunocompromised, which is why my doctors believe that it's been going on for so long. I have hypothyroidism. I have celiac disease. I had mono, which is caused by Epstein-Barr virus 2 months ago. So my body has just taken double or triple the time as all of my friends to be able to fight this thing.
Yeah. So your friends healed quicker than you. They recovered quicker than you did.
Yeah, totally. I had a friend that kicked it in 2-3 days,
Wow.
others up to 5. And luckily we had each other because 2 weeks ago, there wasn't really that much information or even people in the state of California that were our age that were tested. So we were kind of joking with each other, like, oh my God, we might have corona, like completely kidding. And then all of a sudden, as our symptoms continued to progress, we were like, okay, let's self-isolate. Let's go get tested. This really isn't a joke.
So was it easy for you to get tested when you decided that that's something you wanted to do? Was it easy for you to find a test and to get tested?
And did all of you get tested?
So yes, all of us had been tested, and to be completely transparent, it was a really big nightmare. I've actually never felt so like unsafe or unsettled medically, probably in my life. Again, 2 weeks ago, a lot of doctors didn't have their hands on tests. A lot of
Right.
hospitals didn't have testing yet.
It was
Just the
still
access
new.
was non-existent, really.
Right.
So, I mean, we called 4 or 5 private doctors. We ended up calling every hospital in the LA area. I called an ER the night that I started getting like my chest pains, and I was like, "Can I come in?" They were like, "No, stay home." So kind of like that panic of being like, what do we do? Where do we go? But thankfully there were 6 of us. So we kind of all worked together as a team to figure it out, you know? Thank God.
So what was your physical care? Like, what were you eating? Were you like drinking soup? Were there special, was there a specific kind of medication you were taking? Were you drinking lots of fluids? Like, how were you taking care of yourself physically?
So for me, because I'm immunocompromised, I have an array of different supplements that I take on a holistic level that I think really help my immune system. But yeah, we were all doing kind of like broths and soups and chicken noodle soup and things like that. We couldn't taste or smell anything. So imagine there wasn't really a lot of eating going on.
Right.
So yeah, just that was a big one. I think Tylenol to reduce the fever is what we were taking. As we go, we learn new things. Every day there's new information. And that's why I kind of opened up a Q&A on my social media and was like, yes, I have coronavirus. I'm going to destigmatize this process. Ask me anything and start taking it seriously, because every single day I have a friend in New York who's in his 30s and is in great health and was in the ICU on a breathing machine for 2 days. I've heard of another person here in West Hollywood that's 29 who also is on oxygen. It isn't just old people, and it can hit you if you have some underlying health issue the wrong way. And it's really serious that people really understand how serious this can be.
Right.
Absolutely.
And the amount of people that are like, oh my God, I didn't even know 25-year-olds could get this. Like, Of course you can. You can get it. You have to fight it. And you have to be really cognizant of the people around you that aren't able to do so.
Right. Thank you so much. I can't tell you how much we appreciate having you today and you sharing your testimony. I really feel like it's going to be really, really helpful.
Really helpful.
So thank you.
Thank you, Kiara.
And
Feel better.
Feel better.
Yes,
Thank you.
absolutely.
Thanks.
So we have Tanya. She is joining us from her home in Montreal. Hey, Tanya. What's your question today?
Hi, nice to meet you. Thank you so much for having me.
Thank you for being here.
So I had a kidney transplant, and I take an immunosuppressant, so I have a weakened immune system. So I have 2 questions. How can I protect myself since I'm high risk? And should I be worried if everything shuts down? Can I receive my medication, or what can we do?
Got it. Doctor, we're going to have you answer that.
You ask a very important question, and you are someone who is very thoughtfully thinking about the risk that you have, because actually you do have some risk here that may be above and beyond someone else at your age. We don't have a lot of experience with showing that transplant patients in and of themselves have had a bad thing happen with this virus infection, but why take the risk? But I think you ask an even more important question about your drugs. And one of the things we are concerned about today is the vulnerability of our drug supply. It turns out that many of the drugs that we use in this country that are life-saving drugs, like the ones you take, actually are made in China. And, as long as the quality is fine, that's great. But we never thought about the fact, what if that country shuts down? And we have all of our production there, what's the availability of those drugs? And so as we get further into this, if China continues to have problems manufacturing products and shipping them out around the world, then your drugs could actually be in short supply. So we're trying in our own group, doing a lot of work on this to make sure that we have those drugs, that the drug supply chains are full, and that you have that. If you can get an extra month's prescription, that's very hard sometimes with your health plans or how you pay for them. But that would be also a wise idea, because we give you a backup. If for 1 month there wasn't enough drugs, you could get them by already having purchased them. So I think that's a really important point.
Wow.
Got it. Thank you, Tanya.
Thank you so much.
One of our viewers has a question.
And I was just wondering, I'm currently self-quarantining with my 2 pets, my cat and my dog, and I was wondering, can I catch coronavirus from them, or can I give it to them if I already have it? Thanks.
Wow.
There was one event that happened in Hong Kong where we had a dog that was found to be positive in a household where an individual was also infected. The other dog lived in the household and was not. So we don't know what to make of this. We don't think that dogs play a key role at all in the transmission of this. And frankly, as anyone who has had a dog and loves a dog knows, if when you're sick, there's no one that can love you more than a dog.
That's
so
true.
I would not want you to not touch your dog or be close to your dog. That would be the last thing you'd want to do.
Yeah.
How you doing over there, Bean? How you doing?
God,
Good.
well, we have a show coming up on how to deal with stress and anxiety during this time. So, yes.
Dr. Osterholm, thank you so much.
Yes.
This has been very, very helpful. We appreciate you.
Absolutely.
And just get out in the world and keep saving lives.
Yes.
Well, thank you for the opportunity to get the message out. This is important. I think these kind of conversations should happen around everyone's table. And I thank you for leading that off and helping us all understand how we can do it better. Thank you.
Thank you, Doctor.
Thank you so much.
Thank you.
Appreciate you.
You know, I want to thank you for, once again,
The emergency red table.
Emergency red table. Because even for me, now that I understand that literally you just breathing can be a problem, now I understand more why there's being really extreme guidelines.
Right.
I understand it's pretty contagious.
Right.
You know what I mean? So I even got more informed today. Myself got a lot of clarity. So thank you again.
This is a time, you know, I think it's a really beautiful time in a way because a lot of things are coming to the surface for a lot of people.
Yeah.
And a lot of things that I feel people neglected, mainly in health, they're having to take a better look at it, and you know it's a very enlightening time.
Yeah, I would definitely say that. I agree with that.
And I would say
completely.
too that in a time where there's been so much negativity going around, that it is a time for us to like take a second look at how we negotiate the world and how we treat one another.
It's going back to that old school neighborly love. You know what I mean?
Exactly.
It's just how we can assist one another
Right,
through
yeah.
this.
You know, I hope you guys feel a little bit better, and we'll keep talking about it.
Thank you, you guys.
Thank you, guys. Thank you.
Hey RTT family, join our Red Table Talk group on Facebook to become part of the conversation. And be sure to follow the show page to catch up on all our episodes.
I
Which
really
is-
got to give Jaden
with Jaden,
props
yeah.
because he's been
Absolutely.
traveling,
That's what
and he
Jaden's
was
been
like,
traveling.
nope.
I'm going to spend a
Couple of
days
he
here.
said
and I'm
2
staying-
weeks.
He said 2 weeks. He's going to spend the 2 weeks
Yeah.
self-quarantine
Yeah,
because
just to make
Just
sure.
to make sure.
Yep.
It's an interesting time.